morning, students. Namaste. Myself, Seema. I'm going to take a lecture on gouty arthritis today. So, basically, we have to know what a gout is, what a gouty arthritis is, how its progress, what is its pathology, how it impacts the human body, and then the management. This is what we have to cover in gouty arthritis and gout. So if we will see the definition, then it is a metabolic disorder, and but its presentation is similar to the arthritis. As we know in arthritis that there is a degeneration of the joint, there is erosion, then healing with fibrosis and things, the loss of synovial membrane, reduction of the gap of the joint space. So gouty arthritis, there is a two term arthritis. The presentation will be like of arthritis, but it's a metabolic disorder due to the gout. So here mainly what occurs is like accumulation of the urea, too much accumulation of the urea in body led to the metabolic disorder, and then the gouty arthritis. So gout is also is a classified form of crystal induced arthritis. We can also say it in another definition. It's a form of crystal induced arthritis. Okay, so it's like what will be the presentation, how the gouty arthritis will present. So most typical presentation is it will have too much severe pain, inflammation, and flaring up. The redness, the swelling, and the pain will be too much. And what other classical feature of it is, it doesn't occurs like in a pattern or in a systemic distribution. It and it mostly starts with a single joint, like either it's a hand or a foot or a elbow. So like in rheumatoid arthritis, the whole of the small joints of the hand or feet will be involved. And then in osteoarthritis, the large joints, the synovial joints like knee joint and our hip joint, these joints are involved. But in gouty arthritis, it can be anywhere. The inflammation, flaring, and the phase of like acute attack of arthritis will be anywhere, and it doesn't have any systemic presentation. Mostly it occurs in sternocleidomastoid joint, then our foot joint, metatarsal joints, metatarsophalangeal joints. It also starts with like small joints only mostly, but it doesn't give any systemic presentation. Okay, so gout is caused by monosodium urate crystal deposition in the tissue, leading to arthritis, soft tissue masses, tophi formation, then the urate nephropathy. So here the neurons around that area also get affected, and the pathology, the nephropathy occurs. Okay, so in the clinical finding, what we will see elevated serum uric acid level. Okay, so there are two types, gout and pseudo gout. Okay, in gout there will be tophi, there will be like crystals, and in pseudo gout it will be like gout. Every presentation will be gout, but presence of tophi are less frequent. Okay, that's why it is called as pseudo gout. If we will see the prevalence, then it's most common in like Western countries and rarely seen in the children. Okay, and its peak of incidence is mainly in the 5th decade of the life. Now the characteristics, features, or clinical presentations, if we will see, then there are 4 stages of the gout. If we will divide the clinical presentation in stages, then there is 4 stages. First stage is asymptomatic hyperuricemia. So the stage where we don't know, we don't have any symptoms, our uric level increases in our blood. Okay, so that stage is totally asymptomatic. That's why it is called as asymptomatic hyperuricemia. Then after the the elevation and there is an attack of gouty arthritis, the systemic inflammation, the changes, then that phase is called as acute gouty arthritis. Their metabolic changes take place, localized pain, swelling at night, extreme redness, extreme swelling. These things will be there. Along with that, other systemic inflammation, things like tachycardia, malaise, fever, chills. So these will be the presentation. Then again, red and purplish, shiny and tense, warm skin will be there. So these are like first two phase. Then the third phase is the intercritical phase. Intercritical phase is a phase of recovery, we can say, that after episode, after the acute attack, there is this phase will be again asymptomatic, and this phase can go from months to years. Okay, like it can take years to recover, or even in months it can recover. Then here there is a chances of formation of tophi, that tophi can form or cannot be formed. If the inflammation or the attack is not that severe, then there won't be any tophi, but mostly tophi occurs in this phase. So what are tophi is? Tophi are hard nodules of sodium urate deposits. Okay, now the fourth phase will be the chronic tophicus phase. What is the chronic tophicus phase? Again, after the recovery phase, if there is increased in pain, deformity is there because of the tophi, the pain, the tophi will become painful. Again, the joint will show like decreased ROM or functional loss. So this phase is called as chronic tophicus gout. Okay, so there is one more thing, that after the recovery phase there can be chances of again occurrence of the remission. The again the acute phase can attack. So gouty arthritis can have like more than one episodes of systemic inflammation or acute attack. Okay, now if you will see the comorbidities, associated comorbidities, so heart attack, cardiac disorders can also be associated, okay, with the body arthritis. Now management, we know as like drug therapy will be like very much of use to reduce the inflammation, systemic inflammation. So NSAIDs, non-steroidal drugs, then corticosteroids, then urate lowering treatment. जो भी हमारी क्या कहते हैं मेडिकल जो एक्सपर्ट होगी, जो इंटरनल मेडिसिन के डॉक्टर होंगे, उनके हिसाब से कुछ मेडिकेशंस जो हैं यहाँ पे चलती हैं. देन हमारा क्या कहते हैं, अगर हम बात करें आपकी इन्वेस्टिगेशन, अभी मैनेजमेंट से पहले मैंने इन्वेस्टिगेशन नहीं करा. सो इन्वेस्टिगेशन की अगर हम बात करें तो कुछ हमारे क्लिनिकल इन्वेस्टिगेशन होंगे, कुछ हमारे फिजिकल इन्वेस्टिगेशन होंगे. क्लिनिकल इन्वेस्टिगेशन में अगेन हमारा ब्लड का लेवल है, सीरम है, यूरिन में हमारे यूरिक एसिड का क्या कहते हैं, सो हमारा ब्लड टेस्ट, यूरिन टेस्ट, देन एक्सरे टू सी फॉर द like tophi or degeneration of the joint, the change in angulation and the severity and the level of the deformity. All these can be seen on the X-ray. Okay, so these are like our clinical investigation. Then medical management, as I have discussed already, and in medical management we can see the surgical management. Sometimes surgical management is also needed if the deformity is too much and it is hampering the patient life of activities of life. So sometimes the surgical management are also needed. Then the physiotherapy management, as we are physiotherapists, we must know how we can help the patient with the gouty arthritis. So in acute phase, we mostly go for helping the patient in reducing pain, inflammation, with the help of some electromodality, some light mobilization, some light stretching things. But stretching are very much precautionary here in the acute phase, because it can again increase the inflammation and tear and wear of the muscles and ligaments can occur. Okay, then in chronic phase and recovery phase, physiotherapy has a major role to maintain the joint mobility, motor function, muscle performance, range of motion. These all we have to maintain. Okay, and so again exercises will be like mobilization exercise, stretching exercise, strengthening exercise, hydrotherapy, aquatic therapy, electrotherapy. So these will be like treatment of treatment for the gouty arthritis. So the aim for physiotherapist here will be reduce the pain, then not letting to more of the injury or more progression of the joint, worsening of the joint condition. सो अल्टीमेट गोल क्या रहेगा कि हम और ज्यादा वर्सन ना होने दे जॉइंट को. अगर हमारा रिकवरी फेज है, तो मोबिलिटी वगैरह है, स्ट्रेचिंग है, स्ट्रेंथनिंग है, जॉइंट की मोबिलिटी है, आरओएम है, फंक्शनल एक्टिविटी, इसको हम मेंटेन कर सकें. ओके, सो दिस विल बी द अल्टीमेट गोल ऑफ द फिजियोथेरेपिस्ट. सो hereby I'm finishing the topic of gout, and I think you all have understood gout. Do read about this topic, and if you have any confusion, ask me in the Google Meet class. Okay, thank you and do it.